Good evening. This is Scott Kyber reporting for It Pays to Shop Southlake and the Southlake Chamber. We just finished a healthcare town hall meeting for the doctors in town over at the Southlake Chamber. I'm joined by Dr. Deborah Tracy, who was one of the speakers at both tonight's town hall meeting as well as the larger town hall meeting that was over 700 attendees this afternoon. Dr. Tracy, would you give us a few highlights from both this morning's and this afternoon's meetings?
Well, surprisingly, I had a very pleasant experience. You know, I've been watching the town halls around the country and seeing people get tomatoes thrown at them, so that wasn't the case. And everybody was very supportive of Congresswoman Ginny Brown-Waite and her position on this bill, H.R. 3200. I've said it in the town hall, and I've said it in this small hall of healthcare providers that I have disagreements with the bill, and basically the president and his administration promote that doctors do things based on quantity that they get reimbursed for. And I can tell you that doctors do not do things based on quantity. They do things based on what's best for the patient. There are a few unscrupulous doctors that do things that way, but they are not the majority. And when he said at his July 27th conference that a doctor takes tonsils out because he gets reimbursed more, it shows how limited the understanding is, because children with sore throats go to doctors for years and get antibiotics and steroids and treatments and multiple office visits, and finally someone says, well, how about taking out the tonsils? So I disagree with that. I also think that we need tort reform, that doctors do practice defensive medicine, order tests that they don't think will be provide much information, but they do order tests based on defensive medicine. And I do think that the bill does not cover tort reform, but we definitely need tort reform, because malpractice suits terrorize doctors. They make victims of real neglect unable to capture the reimbursement and compensation that they should get for their injury. And thirdly, I think the bill encumbers our nation, which is $1 trillion in debt now, or $10 trillion, excuse me, and 64% owned by foreign countries, with huge, a gazillion dollars. I cannot see how this bill can cost anything less than a gazillion dollars. And I could really go on and on all day long, but I know I'm only supposed to talk for a couple of minutes. I had a wonderful time, and I think the people that came to the town hall were wonderful people, and I think they understand what's going on in healthcare reform today.
Well, thank you so much. On the tort reform comment, I will tell you that I am the son of a physician, and my grandfather was a physician. I have two brothers and one sister, and my mom was a cardiac nurse. None of us went into medicine. While we value and we admire the things that they were doing, my father never even encouraged us, because he was so concerned about just paying malpractice insurance. So I would agree, tort reform is necessary, isn't it?
Well, my son is now in his 30s, and he asked me what he should be when he grew up, and I said, well, not a doctor. So he is not a doctor. Actually, he's a lawyer. The other thing you wanted me to talk about was small business. And I do think the bill has huge encumbrances on small businesses that will provide penalties, taxes, and bureaucratic avenues that are cumbersome to the small business person. Small businesses will be mandated to provide health insurance, and they will be taxed if they don't, and they will receive penalties. So that's about it, and it was wonderful being here, and thank you very much.
Well, thank you for your participation today, and we will see you the next time, and best of luck to you.